Hi, our team members consist of 5 persons, Muhammad Adelan, Daniel Hakim, Nur Alia, Muhammad Naim and Nazri Hazim.
In this video, we are going to talk about blood withdrawal collection.
Introduction of blood sample collection. As we know, blood specimen is the type of specimen most frequently analyzed in the clinical laboratory. Blood can be collected from 3 different sources. This is venous, arterial, and capillary blood. Arterial specimens are used for a limited number of tests, primarily arterial blood gases, which are used to assess a patient who is having respiratory difficulties. Capillary specimens involve the use of a lancet to puncture the skin in order to collect a small amount of blood specimen. And the venous specimens are the most commonly collected and tested. They are used for a variety of tests and require the use of a needle to remove blood from the patient.
The objective of this experiment is to identify the potential sites for blood sample collection and to perform venipuncture and capillary puncture. For capillary blood collection, we only need disposable sterile lancet, alcohol pads, cotton swab and designated pipette.
For the capillary blood collection, finger prick method is being used. First, review the requisition that written by the physician before starting the procedure. Put on lab coat for safety and then ask for consent of the patient and inform them about the blood collection procedure. After that, wash your hand and put the gloves on. Then, choose appropriate depth of the sterile lancet and use the middle finger for the site of collecting specimen. Use the alcohol pad to clean the finger. Meanwhile, rub the finger to improve the circulation of the blood at the middle finger. Then, take the lancet device and then prick the finger. Wipe the first blood drop to avoid contamination. Then, take an appropriate volume of blood using the designated pipette. After that, cover the middle finger with the gauze and put the blood collection into a biohazard container.
Discussion. Finger prick is one of the types of blood specimen collecting under the capillary puncture. This technique is most used in determining the number of blood glucose in patients with diabetes. The method was the easiest to apply and the result outcome most of it are accurate if there is no human error. Precaution need to be taken during the capillary puncture to avoid bad specimen for analyze. The patient also need to fast at least 8 hours before to avoid false reading.
Venipuncture is a procedure which a needle is used to take blood from vein for laboratory testing. Venipuncture may also be done to remove extra red blood cells from the blood to treat certain blood disorder. Sometimes it also called as a blood drawn or phlebotomy. Materials that requirement for venipuncture are glove, needle, alcohol swab, activation collection tube, gauze, percutaneous holder, tourniquet, and bandage. Medial cubital vein usually used as the main site for venipuncture. Alternatively, cephalic vein and basilic vein can also be used. After all equipment is prepared, venipuncture procedure can begin by introduce yourself, explain the procedure purpose to the patient, assess the patient's physical disposition, position patient or either sitting or lying, never allow patient sit upright or high stool or standing due to possibility of syncope. Check the requisition form, request to test, patient information and any special requirement. Once patient preparation is done, we can move on to the venipuncture procedure. Have the patient sit where arm will support and slightly downward. Apply tourniquet to 3 to 4 inches above the elbow. Make sure it's not too tight and it will not remain no longer than 60 seconds. Select the site by palpating the antecubital space. Use the index finger to trace the path and judge the depth of the vein. The most commonly used vein is medial cubital, basilic, and cephalic vein. Remove the tourniquet. Cleanse the site in circular motion with an alcohol swab. Assembly the equipment on your non-dominant side. Remove the needle and attach the needle to the vacuum tube holder and keep the cover on. And put on the disposable glove and reapply the tourniquet when alcohol is dry. Hold the assembly in your dominant hand. Remove the needle cover, thumb on the top and a finger underneath. Grasp the patient arm with the non-dominant hand and stretch the skin downward below the collection site with the thumb. With the bevel up and needle parallel to the vein, insert at the 50 to 20 degree angle and hold the needle in place one in the vein. Hold the assembly in place. Place 2 fingers on the flanges of the needle holder. Use the thumb to push the tube onto the needle. Allow the tube to fill to capacity. Curl the finger underneath and push the needle holder with a thumb. Do not move the needle while removing the tube. Immediately invert the tube to mix the blood and additive. Insert the second tube with the same fashion manner. Continue filling until the requisition is filled. Invert each tube. And lastly, tube begin to fill, release the tourniquet. Place the gauze or cotton ball over the puncture site. Quickly remove the needle. Engage the safety device. Discard the entire needle and the holder assembly on hazardous vein. Apply pressure or instruct the patient to do so. The patient may elevate her arm but not bend her elbow yet. Label the tube with the patient's name, date and time, and physician initials. Check if the bleeding has stopped and apply a wrap, gauze of tape or bandage on patient. Dispose the contaminated area and disinfect the work area. As safety measure, avoid performing venipuncture on arm side of the mastectomy. If it's drawn here, the test result could be inaccurate because of lymphedema. Second one is scar or burn tissue. Performing venipuncture at this site are more difficult due to the scar tissue formation. Next, arm in which blood is transfusion. The IV fluid in the IV intravenous could dilute the specimen. Next one, the hematoma. Hematoma is an abnormal collection of blood outside the blood vessel. It occurs because of the wall of the blood vessel, artery, vein or capillary has been damaged or the blood has leaked in the tissue. If it is drawn here, it could cause incorrect test result. The final one is edema. Edema is a swelling caused by fluid retention. It should be avoided because the accumulation of fluid could alter the test result.
Heel stick procedure. Pre-warming the infant's heel 42 degrees Celsius for 3 to 5 minutes is important to increase the flow of blood for collection. Wash your hands and put your glove on. Using a sterile blood safety lancet, puncture the side of the heel in the appropriate region shown before. Make the cut across the heel prince line so that a drop of blood can well up and not run down along the lines. Hold the baby foot firmly to avoid sudden movement. Make sure that the puncture site is need to be cleaned with alcohol sponge and dry the clean area with a dry gauze pad. Use a gentle pressure to make a rounded drop of blood. Do not use excessive pressure at the punctured site. Be sure to dispose of the lancet in the appropriate container and dispose the contaminated materials in appropriate waste receptacles. Wipe away the first drop of blood using clean gauze. Make sure to wash back your hands. For conclusion, venipuncture and capillary puncture is used when blood specimen collected. For baby, it is heel stick. This is important for laboratory testing to diagnose disease as such. Depending on what kind of test they will be conducted, practitioner will determine to use which kind of blood collection method. Regardless, medical practitioners need to be aware on how to conduct the experiment safely to avoid complication happens.